He's a 20-year-old football player who plays for a local team. So he had met with some twisting injuries in the knee, and he had 2.5 months back. He came to us with just a snapping thing. He didn't have all the tests were negative. 98-hour Latchman, McMills, every test was negative, and this was his clinical video. As you can see, he just had this complaint, that is, this tendon is snapping over the fibula. He came to have the treatment for this complaint only. He didn't have any pain. He didn't have any restriction of movement. He didn't. He can play football right now also. Like, this is the lateral aspect of the fibula.
So the biceps tendon.
This is the biceps tendon, biceps femoris tendon snapping over the fibula. So this is a very rare case in which very rarely it is seen. And one such patient came to our center. So this is the biceps femoris snapping syndrome. So this is the intra-op video which we took after VGS spinal. It also showed the same thing, intra-op video. As you can see here, the snapping of the biceps femoris is seen over the fibular head. So what we did was, a horizontal incision was taken over the lateral aspect of the joint, lateral aspect of the tibial condyle. The superficial dissection was done. The fibers of the lateral collateral ligament were identified, and it was just split. And we have went to the fibular head basically. The common peroneal nerve did not come in our dissection, and also we did this whole procedure which we did was called as a grooving procedure. In this, we have reached the tip of the fibular head. So, as you can see, a horizontal incision is taken, and the tendons of the lateral collateral ligaments are identified, and we have split it, and we have been to the fibular head. So the bicep femoris has basically, it's originated from the ischial tuberosity, and it attaches over the fibula. So the medial fibular insertion of the biceps femoris over this part, which is called as a groove, and the proximal insertion is on the posterior aspect, and the distal fibular is on the anterior aspect of the fibula. So he had the snapping because the fibular head was slightly enlarged, and there was the groove in which this fibers sit was shallow. So that's why he developed snapping. So what we did was, we developed that the groove was made again, and the snapping stopped after the procedure was complete.
Full flex.
So as you can see, the first previously in pre-op, which you can see the snapping was present. Now there is no snapping of the biceps femoris because it fits perfectly into the groove. After full flexion also, there is no snapping. This is his immediate post-op on day 1. We have allowed him a knee bending as tolerated. So on day 1, he can bend his knee up till almost 90 degrees. As you can see, he is bending his knee almost to 90 degrees.